Hi, my name is Diana Chakramakil, and for the topic of the final project, I chose my role as a health educator for suicide prevention in adolescents and teens. According to the National Association of School Psychologists, there is a statement that says suicide is the second leading cause of death among school-age youth. However, this suicide is preventable. So the problem is that this is most commonly seen, this prevalence of suicide is seen among school age and adolescents. Mostly the population we're looking at is 15 to 24-year-olds. They're the ones that are most widely affected. And most teens who kill themselves have either depression or bipolar disorder. So two of the main primary social determinants for this public health issue is family structure and support. So the kids or the young people who feel that they have positive relationships with their parents in a safe and nurturing environment tend to describe themselves as healthier and happier. But single-parent families are at higher risk, and sometimes they struggle to access adequate resources to reach out for help, or not know whom to call, or know what services are available to them. The second primary social determinant is biology and genetic endowment. So basic biology or genetic makeup of a youth can determine their health and their well-being. Young people can be predisposed to different problems affecting their mental health status. So this kind of goes to the situation of where we discuss nature versus nurture, and genetic makeup does play a huge role in this particular situation. Description of the issue at a individual level. The best way to help someone is that to teach them when they're in a bad situation, to listen to them, to talk to them, and to help them deal with their painful feelings, and you can help them defeat whatever causes that suicidal tendency in them. And what hinders this is most teens who have been interviewed after a suicide attempt say that what causes this is their feelings of hopelessness and helplessness. So this is a big obstacle. And suicidal teens often feel like they're in situations that have no solutions to them, and they can see no way out but to end their lives. And they feel helpless and like they have no control over their situation. On an interpersonal level, how someone can help a suicidal teen or an adolescent is if someone is contemplating suicide and telling another person about these thoughts that they're having, and if they specifically tell them to not tell anyone else, then that person has to get help for the person who's having suicidal thoughts. Either call a hotline number or inform an adult or a teacher or a school administrator or a parent or the caregiver or the guardian. Now, what hinders this interpersonal relationship is the death of a loved one, a parental divorce, a separation or breakup of their own relationship, a loss of a parent or a sibling or a pet, domestic violence, being victimized, either child abuse, kidnapping, rape, assault, bullying, physical abuse, sexual abuse. At an interpersonal level, when that relationship is broken or hindered, it truly becomes difficult to reach out to somebody. And at an organizational level, an interactive website is pretty helpful. And also, if you have information on how to help yourself or a friend, a lot of websites do provide these sorts of guidelines as to how to help yourself or a friend that you know is having suicidal thoughts. And also these kinds of websites or forums allow youth to share their stories about overcoming depression and suicide in a supportive environment. So there will be no judgment and no criticism, but this is sort of like an online support group where people can share their thoughts and encourage one another to, stay out of trouble. And what hinders this is, on these websites and forums, it is important to watch out for bullying, or to not disregard anyone's feelings, and to not make light of the feelings that are being shared. At a community level, what can be done to help is with programs like the Youth Suicide Prevention Program. They make a long-term commitment to changing behaviors and attitudes in individuals, families, and communities. And it is so important that every citizen of the state should understand that while youth suicide is a problem, there is something that can be done about it. It doesn't have to be a hopeless or a helpless situation. By educating, oneself and others, there is a difference that you can make in preventing youth suicide. Something that can hinder this community level interaction is when someone hears of a suicide in one's family. It instead of thinking, oh, that happened to someone else and it may not happen to me, always remember that your own child or your own sibling or relative is not immune from such tendencies, and be empathetic and compassionate to the people that have lost their loved ones due to suicide. Policy level, if educators and school leaders or school counselors and psychologists can implement policies into practice, then that would make a significant change, to enhance the whole school environment. As of now, there are 25 states in the U.S. that require educators to receive training to prevent suicide. Now, this is very important because these recommendations and these policies are rooted in best practices, or evidence-based practices as we call them. And this helps the schools achieve an inclusive and a comprehensive suicide prevention plan. It also has to complement existing state laws to make it more effective. What can hinder this policy level is, at a policy level, what can be hindering is having an inadequate suicide prevention program. So school practitioners can face liability in some situations by being held personally responsible. So it has to be a combined effort from school administration and teachers to protect students and to avoid tragedy in the community. Some of the proposed interventions would be teachers in a school setting. They can always provide some sort of preventive education, risk management for the teens by asking them to fill out maybe questionnaires or surveys, and that way you can do like a self-report screening to identify potentially troubled or suicidal adolescents. Also, helping a student turn around a bad situation by just listening to them and helping them deal with their painful feelings. Maybe just being a good listener can go a long way. And also promoting relationships among families and building a better relationship, helping them build a better relationship with their own families. Another intervention would be if a friend or a peer is aware of what the person is going to do. Like I said before, call a hotline number or inform an adult or teacher, a school administrator or parent, and tell them that this person is having suicidal thoughts. And I was told to not inform anybody, but it's always best when someone's life is in danger to inform someone responsible. Also, school counselors and psychiatrists they use something called cognitive behavioral therapy that they use with the depressed teens to help them change their maladaptive ways of thinking and ways of dealing with the situation, and asking them to come up with effective responses to different stressful situations in their lives. Now, proposed evaluation is to defeat one of the main causes of teen suicide, and that is bottling up and keeping feelings and emotions inside, and instead to share what's on one's mind, and also doing follow-ups and referrals and surveys and questionnaires so that they can ask students how they would deal with future stressful situations in their life. Also ensuring lasting change in the factors and conditions that place these young people at risk, and to help them come up with effective responses to stressful situations in their lives. Potential challenges and barriers would be one intervention that we came up with was school teacher risk management through the referrals, and for that the challenging part would be a lack of budget or enough personnel for maintaining these records and keeping up with these students and having to assure their safety and their confidentiality. But on the other side, if schools can work with these programs like lifeline programs and help identify and refer more students for risk of suicide, then that can be implemented throughout school districts. If it works for one school, maybe other schools in the same district can adopt that policy and it can spread out from there. Another intervention was informing someone responsible or calling the hotline. The one challenge is that if this does not happen immediately, the suicidal teen can act violently. So timing is very important. But the solution to that is definitely, trying to reduce the rate of violence by making sure that the relationship with the teen and their family is good, and the teen and their friends and teachers is healthy, so they don't have a lot of violent tendencies or a lot of other stressors that add to the levels of violence in their own lives. The third intervention was cognitive behavioral therapy, and a challenge to that is, again, if after the clinical visit is done, the patient doesn't necessarily have to stick to therapy protocols, so or be in compliance with the recommendations of the clinician. So the solution is to follow up with phone calls and questionnaires and ask them how they would deal with future stressful events. And this has been shown to be a very promising form of therapy. And this is a logic model that I had posted with the inputs, the activities, outputs, and outcomes, and the impact that is desired is, of course, decreased rates of teen suicide at different levels, how teachers, friends, and peers, and also school counselors and school psychologists can help, the ultimate goal being decreasing rates of teen suicide. And there's the bibliography, and I've come to a close of my presentation. Thank you.